I want to speak about the ongoing issues in geriatric ward and CUH. At the outset, I suppose, let me be clear here, I want to also talk about patient safety and also staff safety. For the last 4 days, I've been listening to stories on, you'd probably be familiar with the station Red FM, the Neil Prendeville show in Cork, about witnesses and what they've experienced inside the geriatric ward there. And in the last number of days, I have received numerous pieces of information about managers at the top level not coming down onto the floor and inspecting the place. I've heard issues where frontline staff workers, nurses and stuff, if they ask for help or seek or tell them their managers that they can't cope, they're being classed as troublemakers. Now, how do you run a service when the top and the middle won't link up, never mind the bottom? Obviously, the issue here is obviously long-term underfunding. Recruitment issues also have been an awful issue here. But also there has been a lot of health and safety issues. I listened to one poor woman that said, in the shower unit, remember this is a geriatric ward, in the shower unit, there was no seating for the patient to shower. It was a simple little handrail. That's it. The same lady witnessed a gentleman mopping the floor, and once he was finished mopping the floor, he proceeded to mop the shower tray with the same mop. So health and safety seems to be a big issue there. I also want to get you to investigate, I suppose, a number of issues here. Number one is the conditions that I've heard inside in this ward are absolutely appalling. It's 2020, and we're letting our most elderly and frail down. I listened to another woman that said she will never go back to that ward or even go to hospital. She's in her 80s. She said she'll take her chances. If she breaks something, if she can get to her armchair in her living room, she'll happily die there. Now, that's not my words. And as I said, I've been listening to this debate on the radio station for the last number of days. I'm not taking the sides of patients or families or staff and their families. I'm here to ask you to investigate so we can help everybody here, and that is the staff and the patients inside in CUH. I also want to raise an issue that I've been informed by penny pinching. And it's not picking on any particular line of staff, but this is down to contracts and management again, where agency staffs are given time slots of 2 minutes to clean Area A, 5 minutes for Area B. You know, it's totally inadequate. And then we're wondering why people are getting sicker when they go to hospital. Another issue I want to raise in this very short time, and I will revisit it, is the so-called unannounced visits by HICWA. A lot of these so-called unannounced visits are not unannounced visits. I have learned today that the so-called unannounced visit in Cork geriatric ward is next Monday. I've been told that staff will be brought in over the weekend to move trolleys into empty wards and clean the place before this is done Monday. Now, how are we to have fairness to help patients, to help the safety of staff that genuinely want to work here, when there is nobody taking responsibility? And if we have HICWA who are not doing their own job properly, well, somebody has to be responsible for it, Minister. And that's what I want to get to the end of here is, we need to help everybody in this scenario. That is, the staff and the patients inside in CUH in Cork. And I hope to God it's not happening in any other place around the country, but I suspect if this is what I've been told with so-called unannounced inspections, I feared there could be a domino effect. Thank you, Minister.
Thank you, Deputy. And Tara.
Raising this issue and giving me the opportunity on behalf of Minister Donnelly to provide an update to the House in relation to concerns over hygiene and infection control standards at Cork University Hospital's geriatric unit. Firstly, I want to assure the Deputy that infection, prevention and control is generally well developed in our acute hospitals. Indeed, prior to the pandemic, all acute hospitals had outbreak teams in place. However, while it was clear that systems were in place to manage outbreaks and control further spread of the virus within the hospital settings, questions arose as to whether there was sufficient focus on outbreak prevention. Given the insidious nature of the coronavirus, at their meeting on the 31st of March, NPHET accepted that more can and should be done, and management implementation of a suite of 29 measures to prevent transmission of the virus in acute hospitals, to slow the demand for specialised healthcare, safeguard health risk groups, protect healthcare workers and minimise export of cases to other healthcare facilities and the wider community. The HSE has established an overarching governance structure to provide oversight for all issues relating to COVID-19 infection control, and in addition, the Department of Health has been working with the hospital groups to implement these NPHET mandated measures across a number of different action areas, namely governance, risk management, outbreak management, staff symptom declaration, staff segregation and adoption of social distancing guidelines. One of the measures mandated by NPHET was a desktop review by HIQA of acute hospital infection prevention and control preparedness for COVID-19. The report of that review has now been published. While this report highlighted the progress which has been made in recent times to expand IPC capacity and capability in acute hospitals, deficits in IPC capacity were identified. Following discussions within the Department and with the HSE, it was agreed that there was a need to consider an integrated approach to address IPC deficiencies across the acute hospital and community sectors. In that regard, I am pleased on behalf of Minister Donnelly to inform the House that funding of almost £4 million was recently approved to address immediate IPC requirements in acute hospital and community services. This will help to minimise and mitigate the risk to staff, patient and service users and facilitate the delivery of health services, delivery of safe health services. In Cork University Hospital, the care of the elderly service is delivered on Ward 1A, which is a 35-bedded ward. With regard to hygiene and infection control standards, the HSE has advised that cleaning staff are based on the ward from 8 a.m. to 8 p.m, with hygienic service available throughout the night as necessary. The HSE has also advised that monthly hygiene audits are carried out along with annual environmental hygiene audits. The HSE has further advised that prevention and control of healthcare-associated infections training is provided on a continuous basis for all staff, and this has been enhanced throughout the COVID-19 period.
Mr. Oireachtas, 2 more minutes.
You know me, again, I'm straight talking. Will we stop blaming COVID for this? I never mentioned COVID in any part of my opening remarks. Some of this is historic. It's gone back to 2016, so we can't blame COVID. We probably can't blame Brexit. What I'm trying to say to you here is, and it's my job as a public representative, if people, whether you're a patient or a staff member, if you're not being fully supported and people's health, well-being, mental health, physical safety is being put at risk, it has nothing to do with COVID. It has to do with management of the area, misrepresentation, and also what I just said to you a while ago about the so-called unannounced visits. You come back and you give me a line here of a risk management, outbreak management, staff symptoms declaration, staff segregation. And we're not talking about this. We're talking about elderly patients being left in their bed soiled without help. We're talking about patients that can't feed themselves when they put the plate up on the table, walk away, come back in an hour and notice the plate is still full, they weren't hungry. There are certain protocols that are not being properly pushed here. And what's happening is the public are being aggrieved, they've had their bait, they're blaming the staff. The staff are overworked, under-resourced, and what I'm asking you to do is forget COVID as an excuse. We're supposed to be one of the safest places on the planet as your hospital, and the patients and the staff are not being looked after here. And I'm asking you to carry out a full review, and I'm asking you as well to find out if this unannounced so-called visit is actually happening next Monday. Is that true? Because if that's true, they're lying to you, and I've said it to other ministers here over the years with mental health. They're not telling you the truth. Now, you cannot do your job properly. You cannot come into this house and explain to me that, well, this is what I've been told. It might be what you're being told. But if you go back and listen to 4 days of people ringing in, mothers crying, patients crying, staff crying, and you're telling me, we'll blame COVID, we'll throw in a few old measures there, we'll thank HICWA and NEPID, and everything will be grand. It's not grand. And I'm asking you one more time, please, on behalf of the people inside there, on behalf of the staff, their families, their patients, their families, to investigate. And if it takes investigating HICWA, who put out that report? Who said, if it's true, who said that there's an investigation, an unannounced visit by HICWA next Monday into the Ward 1A in CUH, and there will be staff there over the weekend to sort things out, and I can guarantee you that there will be a chair inside in the shower. There won't be a smell out of the toilet bowl, and people will be fed and everybody will be happy. And if that's true, we should be ashamed of ourselves. We're here to do things, to represent people, to get things right. And as I said, I'm fed up, and I'm not here long enough, but you can hear that I'm angry. I'm fed up with getting these one-liners, and again, it's not your fault, and it's not a personal attack on you. It's on the system here. I don't trust the HSC. I don't trust HICWA. But I do trust the parents and the service users that have their testimonies on here. I do trust the staff, and when they have their testimonies on here, now somebody has to be telling the truth and somebody has to be telling lies. And at my point, and that's why I'm asking you to investigate it, I believe the staff inside there, and I believe the patients, and I believe the families and that, they're telling the truth, and you're being misinformed by HICWA and by the HSC. Thank you.
Thank you, Deputy. Montara,
in conclusion, I will bring your observations back to Minister Donnelly. The upset and of the patients and staff and family has been noted. Also, you've called on various protocols to be brought in, and also this unannounced visit by HICWA that you've talked about that may be turning up next Monday. I will try to clarify those issues for you. It is now clear, though, that in order to safely and sustainably manage the provision that the health service into the future, significant investment will be required to build the IPC capacity in the future in the coming years. And we want to ensure that our health service provides safe, quality and timely care. It is a priority for the government, and in that regard the HSE have provided assurance that all hygiene standards are adhered to on Ward 1A and indeed throughout Cork University Hospital. I will bring your views and your concerns to the Minister, and thank you again for raising this very, very important issue.